Somebody asked how I decided on going into neurosurgery. So when you're in medical school, you have 2 years where you do a lot of book work and you're studying all the time. And then you would take an exam, and that score would kind of help you understand how competitive you'd be as an applicant. And then you go for your 3rd year and you just rotate on all the different rotations that are out there, and it lets you kind of see all the different fields, see what you think would be a good fit for you, what you enjoy, what you don't enjoy. And so where I went to medical school at Georgetown, we had an opportunity to rotate on many different specialties and rotations. And so I did, we got to spend time on 3 of the 6 surgical subspecialties, and you got to learn on the other 3. We had lectures on all of them. So when I was rotating on the surgical subspecialties, I had played Division I soccer, University of Denver. So obviously orthopedics was one of the 6 I chose. Neurosurgery, I'd always been interested in. And also I spent time with ear, nose, and throat team in those 3 services. And then we just did lectures for the other specialties, plastic surgery, urology, I believe ophthalmology was the other. And so when I was on neurosurgery, even though the hours were very long, they went by quickly. So if I compared that to another specialty I tried, which was like dermatology, which was very short. It was very short hours, short days, but it just dragged on. Neurosurgery would be way longer, 120 something hours, a week, easy sometimes, but it just went by very quickly. I was never looking at my watch, being bored that this was happening and trying to get out of there. And so that was for me, when you love what you're rotating on, what you're doing, then when you're working, it doesn't even feel like work. And this group, they always had fun on rounds. So you worked hard, you played hard, you took good care of patients. Everyone, really a bunch of high caliber people that excelled and worked really hard to take care of people. And when you have issues with the brain and the spine, neurosurgical issues, patients, all the superficial stuff in life, that stuff melts away. When someone has a brain tumor that's threatening their life, no one cares what school you went to, how much money you make, what kind of car you drive, like all the stuff that people focus on in society with money, like that stuff just melts away. All it comes down to is trying to save someone's life and help them, restore them to health. And people want that obviously more than anything in that situation. So for me, that was like a very special part of medicine, like surgery, that you didn't have in every single field. And so that's how I kind of ended up deciding on neurosurgery. I love doing brain and spine tumors, and as time went on, I spent more time on the service. I love doing trauma cases and learning all about the field that way. But I think one of the biggest pieces of bad advice medical students will get is, pick a field based on lifestyle. And you have to know yourself, but the blessing of medicine is having the opportunity to do something that you love doing, that you just love doing, and it doesn't even feel like work a lot of times. And if you can get that, that's one of the greatest blessings you can have in medicine, is to have a job where you make this massive difference. And every day when you get up, you're going to make a huge difference in people's lives. And so I think people should know themselves and know how they would want, the best they can, know what they want their life to look like. But I really think you try to base your decision as much as possible on what your passions are, because you're also going to be better at what you love doing. And that's the best advice I think I've had for that.